We're able to establish links with Dr. Nuhu Solomon Ayegwu. And if he's there, let's see if we can get him on. Establish links.
Thank you very much. It's a pleasure. Good evening.
Yes, good evening.
Good evening. Yeah, good evening, sir. Yeah, good evening, sir.
Yes, good evening. Let's hear your inputs. Obviously, we've listened to the other speakers here.
Thank you. I think bringing up this very important issue on the national discourse is very important at this time, particularly now that we discover that disease burden is on the increase. The occurrence of diseases in the nation is becoming rampant, and when we assess the state of our health services, it is quite very low. In view of this, we have been emphasizing on the role of the critical stakeholders. It has always been commonly reported that the major indices with which we can measure the effectiveness of health services of any nation or state is a drastic reduction in the occurrence of diseases and, if possible, total elimination. Now, with the increase or with the rise of disease burden in the nation, with the mortality rate on the increase for our newborns under 5 and so on and so forth, and even the pregnant women, it raises a serious point of concern that we need to do a lot to improve our healthcare system. Now, from even the topic of this discussion, the challenges we have in our health sector today are very glaring. And doctors who are on the table for this discussion, they have highlighted so much. But I think a time has come, we need to move from highlighting on theories, principles of operations, to pragmatic approaches that will help to actually reduce the rate at which this is affecting the health of our nation. And in view of that, I am advocating that we should return back to what we used to do in those days, particularly before the introduction of primary healthcare delivery system in this country, when we were using the basic healthcare scheme. Now, the primary healthcare delivery system has been introduced in our healthcare system in the country with a view to make health services accessible, affordable to the people. But as of today, is this healthcare services still affordable? Is it accessible to our people? Now, we have health facilities, but these health facilities are having lots of challenges. The problem of brain drain in this country. Many of our health workers are moving to other countries of the world because of the lack of improved remuneration for health workers. Again, our health facilities, there are health facilities you go today, you cannot even see 2 beds. You may not be able to see 1 or 2 nurses. So it's a serious problem. And again, when you go to a health facility, for example, we're supposed to have different health professionals, nurses, doctors, pharmacists, pharmacy technicians, dental technologists, nutritionists, dietitians, and all other relevant health professionals. But these are not available. And what is the reason? The reason, again, can be traceable back to our health training institutions. The health training institutions in this country, like colleges of health sciences and technology, are being grossly neglected by government. In short, one most surprising thing is that government of this present day provide facilities for the different tertiary institutions in the country, but they classified health colleges as monotechnics. And for that, the law now, exclude them from this, intervention of government. And that is why colleges of health sciences and technology, which is given back to by the introduction of primary healthcare in Nigeria, is being greatly neglected. And there are dearth of facilities in these institutions. And as a result of these, we can no longer train these different cadres of health professionals. If we're having hospitals and these professionals are not there, how effective will our services be? So these are things we need to look at very critically. In those days too, we have drugs that are made available in our health facilities. But as of today, are we having drugs available? You come to health facilities, You cannot access drugs that the people, the clients or the patients will make use of. So it's a very big challenge. Therefore, as government is trying to prioritize the issue of provision of healthcare services for the people, I want to advocate that the improved budgetary allocation of government should also take care of these areas.